Now, Nakuru County is on heightened surveillance alert for M-Pox after Kenya's fourth confirmed patient was diagnosed in the county. The patient is a truck driver from Rwanda and had been traced to Gilgil. As the disease adds count in the country, there is a power squabble at the Ministry of Health between the Principal Secretary for Public Health and Professional Standards, Mary Muthoni, and the Director General of Health, Dr. Patrick Amoth, on who has the mandate to announce the M-Pox status in the country. Bridget Ngana begins our broadcast tonight with these battles, that against M-Pox and that at the senior levels in the health ministry.
The Rwandan truck driver had been in isolation since Wednesday when public health officials in Nakuru admitted him to the isolation facility at the Nakuru Teaching and Referral Hospital until his test results came back positive for M-Pox on Friday evening.
We have a disease surveillance mechanism in a center in Nakuru, and this is not the first case that we have tested. We have tested about 17 so far. So this is the first positive that we have had.
The Department of Health in Nakuru has now activated the community health promoters to help with identifying and contact tracing of people who might have interacted with the M-Pox patient.
We want people to be careful, yes, but we don't want people to be excessively worried. When you visit a health facility, we want to recommend that you mask up.
The Council of Governors will also have an emergency meeting next week to assess the preparedness of the counties to deal with the M-Pox outbreak in the country, since health is a devolved function.
We need a budget, either from the emergency kitty or from the public health, to be set aside and be ready for utilization if required. Otherwise, we will not be able to contain this situation.
By Friday, the National Public Health Laboratory had processed 89 samples of suspected M-Pox cases, 3 of these samples testing positive for M-Pox, while 79 samples testing negative. 7 samples are still under analysis. More than 500,000 people have been screened for the disease at the 26 points of entry in the country. M-Pox symptoms include a rash, fever, exhaustion, swollen lymph nodes, muscle aches, and a sore throat. And those exhibiting any of these symptoms have been asked to rush to the nearest health facility. However, there are fears that the ongoing push and pull at the Ministry of Health between the Director General and the Principal Secretary Public Health as to who has the mandate to lead the M-Pox National Public Health Operations Center could affect the coordination of how the country will deal with this global public health emergency. Bridget Ngana, NTV.